Welcome back. Now, Novo Nordisk's weight loss treatment Wegovy has landed on South African shores. With obesity affecting almost 50% of adults in the country, Wegovy's approval for weight management marks a significant milestone. However, the company faces competition from existing treatments and potentially other market players. Darling Lachela was joined by Jonas Lind Hansen, Head of Legal Ethics, Compliance and Quality at Novo Nordisk South Africa, to unpack the landscape. Let's take a look.
If you look at the problem, because it is truly a problem, if you look at South Africa, there's nearly 20 million adults living with overweight obesity. And obesity by itself is not just a condition that requires medical treatment.
Yeah.
It actually is, to some extent, something you can consider almost the mother of all diseases. It's associated with more than 200 different other diseases. That could be your cancers, your hypertensions, your type 2 diabetes, and so on. So tackling obesity and the opportunity to tackle obesity is actually an opportunity to tackle the root cause of many of the diseases. So it's a issue that is a epidemic.
Yeah.
And if we look at it, it's also not fairly distributed like many other things in life. Women are unfortunately represented worse than men, which means that 2 out of 3 women in South Africa are suffering from obesity, where it's 1 out of 3 men. So it is truly a problem that needs to be tackled.
So yes, on one hand, we are seeing it as a problem, right, where we are seeing obesity rates, diabetes rates here in South Africa really high. And that does, of course, open up the market, provide opportunity for companies like Novo Nordisk to enter the market. But on the other hand, we do see what's been playing out in the weight loss market in particular, where people are taking advantage of those drugs and not necessarily people that are suffering from obesity or suffering from diabetes using these drugs. And I guess also just affecting the supply dynamics, because when you look at who is supposed to get these drugs, talk to me about everything that's playing out on that front.
Absolutely. So if you look at it, if we look at those 20 million adults in South Africa living with overweight obesity, that means that we have 20 million people that potentially could suffer from other diseases. Mm-hmm. At Novo Nordisk, we have done research in the obesity space in more than 25 years. And many of us still sit with this in society in general. Many still sit with a way of thinking of obesity as, well, if you eat less and move more, that will probably solve the problem. What research and science shows is that it's not like that. It is a serious chronic disease that requires medical treatment. And you can say all of that has led to a way that people in general are seeking treatment in a way that we haven't seen before. That means that they go to social media, they go to, we even speak about it at your show now, right? This is of public interest because it affects so many of us. The downside of that is that that there will be some people out there that are trying to make advantage and take advantage of that. Essentially, they are taking advantage of people that are actually seeking to improve their health by offering what could be copy solutions. So that's what we call counterfeit or illicit compounding solutions, which essentially are products that are not approved by SAPRA. They haven't been tested. We don't know what's inside. And they're offering them in all of these channels where you wouldn't normally receive your medical treatment. So again, if we look at obesity as a serious chronic disease, it means that you should treat it like one. That means that you should go to a doctor, and that doctor can prescribe a medication for you based on a medical assessment, right?
You touched on
What happens in reality is that it happens via social media. It happens in WhatsApp groups, on Facebook, on Instagram, where people are seeking these drugs. And unfortunately, some are using our good name, you can say the product that we have innovated and invested in and done research. We're talking research in a scale of thousands of people being tested in clinical trials. Against products that are not approved, not tested, and where we don't know what's inside.
You touch on something quite important there around, the copycat drugs, the replica drugs that we are seeing in the market. From your analysis, just your sense, do you think that perhaps we need some sort of regulations to kind of support the market and get rid of those drugs?
Yeah, so we actually do have regulations. So all of this is regulated, and what is happening with the counterfeit, copycat, or illicit compounded drugs is that they are essentially just ignoring the rules. So had this been anything else, you can say authorities are working hardly. We are working close collaboration with SAPRA. We're working with the police services as well.
Okay.
We're also taking action directly against some of these companies. So we are in active litigation against some of these companies because by the end of the day, this is a patient and public safety risk. Remember, these are drugs that you inject into your body.
Yeah.
And I'm not sure how you feel, but I wouldn't inject something into my body that I couldn't trust and that I didn't know was approved, tested, and where I know what's inside. It's not like a fake pair of sunglasses. I'm sure we can all relate to maybe getting a fake pair of sunglasses. This is medicine that you're injecting. And to be very honest, I don't think anybody should compromise on their health to get access to drugs that are not safe. And they might even not be effective as well, right? So you don't get anything out of seeking those drugs. So I think a key message is essentially that people should go and seek a doctor, and that doctor can help with a script of the real products that are designed, developed, and intended for this use. And actually at Novo Nordisk, we have for South Africa introduced a website that we call truthaboutweight.co.za. On that website, we have a locator, HCP locator, where you can find a doctor that's qualified, interested, and takes obesity serious, so that you can get the treatment that you deserve already today.
All right. So the replica drugs aside, the copycat drugs aside, talk to me about the competition landscape, the competitive landscape that is. I can imagine that, it's quite tough. We do know that your direct competitor, Eli Lilly, also in the SA market through a partnership with Aspen.
Exactly. So you can say when you look at the competitive space, any innovative and I would say legitimate competition is good. That's good. It's good that more people are interested in obesity, more see the potential, and that science is essentially driving how we are treating the disease. If you look at the illegal market, so the copycats, your counterfeits, and your illicit compounders, that market is unfortunately quite big in South Africa, and we're talking thousands of patients that are monthly getting these drugs in their hands. What is the good news is that we now have, with Novo Nordisk introduction of our new product launched in South Africa, we actually have alternatives that have been approved, tested, and designed for this purpose.
All right. And then before I let you go, quickly walk me through your expansion plans. I know that South Africa is the first African market where you are launching Wegovy. Do you have plans to take it outside of South Africa into the greater continent as well?
So South Africa, we're very, very proud for South Africa to be the first market to launch Wegovy in Africa. The plan for Novo Nordisk is to launch Wegovy as broad as possible. We want people to have access to our medicines, but obviously it takes time and it is a phased rollout, but we are launching at a very rapid speed across the globe. And I'm sure that South Africa will not be the only market in Africa that gets access to our newest innovation.
That was Jonas Lind Hansen, Head of Legal, Ethics, Compliance and Quality at Novo Nordisk, South Africa.